Hello and welcome to the Emil Barna Podcast. Alright, today I want to start off by saying there's going to be a lot of discussion around mental health today. Suicidal ideation, kids' health, adult health, trans-cultural or trans-geographical impacts of the COVID-19 lockdowns. That's all going to be in my discussion today. Okay, today's format's a little bit different. I'm not interviewing anyone. I'm just going to be reviewing a whole bunch of peer-reviewed data as well as stories around the impacts of the COVID-19 lockdowns, especially around our children. And some of these stories are super duper triggering. I mean, I couldn't contain myself in certain accounts. Now, I do want to stress that these accounts are anecdotal to begin with. So where they are anecdotal and where their sources lie, I do want to stress that I will be telling you where I've resourced these. And then when I discuss the peer-reviewed research, I will make sure to make a reference around where this peer-reviewed research is coming from, the dates, the countries, all that sort of stuff. So today's going to be a bit of a deep dive into that. I don't want to hesitate any longer. It's the start of September, and that's important because everything here in Victoria is changing so quickly in terms of restrictions. For those who aren't in Victoria and are listening to this, it's really important to know that Victoria has been in the longest lockdown in the world for comparatively minuscule cases, and for such a long time there was a huge emphasis placed on cases. So anytime there were an increase in cases, even if there were under 10 cases, we would lock down in our state. The entire state would lock down, which means you could only go out of home for a certain amount of reasons, like shopping and exercise and that sort of stuff. But I do want to stress that the kids haven't been able to go to school for the majority of the last year and this year. In terms of actually they've been homeschooling more than they've been at school, which is really, really hard for parents who are working full-time, working from home, trying to balance schooling and kids and all that sort of stuff. But I do want to bring it back and say there's a lot that's riding on these discussions, because in my field, in the mental health field, which I think is really troubling that this isn't being discussed to the extent of other areas. We're more concerned about managing this virus, COVID-19, than we are at implementing ways to proportionately work through and come up with policies that are going to balance mental health. So I don't want to spend too much time talking from a political point of view. That's not my training. That's not my area of expertise. I do want to bring it back down to mental health. And I will start off by saying, listen, The Australian, which is a very popular newspaper here in Australia, released an article about a week ago that says, and I quote, "An average of 156 teenagers a week were rushed to hospital after self-harming and suffering suicidal ideation. This is an 88% increase on last year," end quote. Now, I think this is really important because here we're in 2021, it's September, things, one day things are being shut down, the next day restrictions are easing, high emphasis on vaccination rates, all that sort of stuff. And that's all well and good, but the discussion isn't necessarily being had around the correlation or even causational links between how these lockdowns are impacting our children's mental health, our mental health as a society. And what we do know is that when we look at the mainstream media outlets, even The Age came out, which is another popular newspaper here in Australia. The Age came out and said that a proportionate response needs to happen and we really need better policies around all this sort of stuff. But we are seeing an increase, especially in the younger generation, of suicidal ideation, which is kind of like thinking about suicide and contemplating it more than the past, and then suicides in total. That this is what we're seeing. The most serious cases, I quote, where teens required resuscitation and emergency treatment surged to a 6 weekly average of 37.3 cases to the end of May. This is an 83% rise on last year and a 162% increase on 2019. End quote. That's again from the Australian, and they're reviewing a whole bunch of data around the suicide statistics that we have out already. I think it's important to note that 2019, no COVID here in Australia, 162% increase on rates of suicidal attempts that required resuscitation just 2 years later. This is a huge, huge thing. And in terms of the discussion, where is it? Where is it? How many mental health professionals are speaking out? Even the chief psychiatrist in Victoria admitted just the other day on the impacts of mental health here in Victoria, but that was the first time he had ever appeared in a press conference, from my knowledge, to discuss certain things. But there wasn't any discussion around the correlational data and what people were experiencing at that time that caused them to become so down, so depressed, so hopeless that they resorted to suicide, especially young kids. All right, I'm going to jump into some of the research. The research is going to be drawn from a whole range of different outlets, some of which are government, Australian government, some of which are research from peer-reviewed journal articles in different countries, including Australia, one of which is a meta-analysis. The Australian Institute of Health and Welfare, which is an institute from the Australian government, put together a report that monitored the psychological distress associated with loneliness here in Australia. And they polled a whole range of people, and what they found is those who were more isolated, which if you consider the entire Victorian population and inability to meet anyone else, that would kind of fit most of us, or if not all of us. Those who are more isolated tend to have higher, if not severe, psychological distress, which was a significant increase in 2021 from 2017. So 8.4% in 2017 versus 9.7% in April 2021. And this continues to increase. I mean, this was April, we're in September, and we continually see the increases in this data and the impacts that ongoing lockdowns appear to be having, even from an Australian governmental point of view. Importantly, we also see that the number of self-injury ambulance attendances are up 17.6% compared with 2019. We see more and more people that are self-harming with regards to the distress that they're feeling. Now, of course, we can't put a one-to-one correlation here or a causation clause, but we can see that if we compare it to when there have been no lockdowns, we can start to see that there is an increase in distress, which has led to a significant increase, 17.6% increase. It got almost 18 more people out of every 100 starting to take matters into their own hands and find that the only way to get out of this dump is to harm themselves. This is what we're seeing. An ABC News article surveyed some of the statistics, and what they found was that more ambulances were called for young women aged 15 to 19 for self-harm, suicidal ideation, and suicide attempts than for any other age group. I want to jump into a post that was received on social media, a message that was sent to a Instagram influencer by the name of Rosalia Russian, which for some reason is spoke out against. She's got quite a large following. She spoke out against these sorts of lockdowns and how they are impacting mental health of young people. And a lot of her followers started to send her personal accounts of what they're experiencing, and she soon became a bit of a vault when it comes to all these stories. Same so with the Instagram page Shadow Pandemic Vic, which I'm gonna be citing right here. So let's look at what the ABC has found, what the Australian government research has found, and the personal accounts of people who are reaching out to, of all people, influencers, because they seem to not know whether their voice is being heard. I quote, "My sweet niece tried to take her life 2 weeks after her friend did successfully. She is in and out of blank psych ward. But it's hard because they are overwhelmed. We have no voice. Aren't we supposed to be nurturing our kids at all costs? They have been thrown under the bus and suffering more than anyone. Shame on us, I say." End quote. Another person said, and I quote, "Our neighbour's son tried to take his life a few nights ago. He is now in a coma. This needs to stop." End quote. Here's another one. Quote, "A girl at my daughter's school committed suicide a few months ago. Just terrible. And our girls are trying to comprehend why someone would do that. Things for our kids need to change ASAP. They need to be at school." End quote. This one's really tough. Quote, "Last year, blank school lost 6 boys from the one school and lost another one this week. They were all 14, 15-year-olds. It was really affecting kids more than we realize." End quote. I'm going to pause the accounts for a moment and return back to some research. There was a meta-analysis that was undertaken in August 2020. Now, remember, this is mid through last year. Things have only gotten worse when it comes to lockdown extensions and the rest of that, with no end in sight, mind you, in 2021, in September 2021. What the Psychiatry Research Journal found in an article entitled "Impact of COVID-19 and Lockdown on Mental Health of Children and Adolescents, a Narrative View with Recommendations." End quote. What they found in that particular study was that, I quote, "Children with special education needs are at high risk." End quote. Quote, "Since the pandemic and lockdown has caused economic distress, there are indications of increased abuse towards children." End quote. In the UK, a survey of 2,111 individuals with a history of mental health conditions, I quote, "Lockdown worsened their condition. About 26% of them were unable to access the medical health services they required." End quote. What they also found is that children and students tended to report feeling helpless. The study also said, and I quote, "Absence of structured setting of the school for a long duration resulted in disruption in routine, boredom, and lack of innovative ideas for engaging in various academic and extracurricular activities. Some children have expressed lower levels of affect for not being able to play outdoors, not meeting with friends, and not engaging in the in-person school activities. These children have become more clingy, attention-seeking, and more dependent on their parents due to the long-term shift in their routine. It is presumed that children might resist going to school after the lockdown gets over, and many face difficulty in establishing rapport with their mentors after the schools reopen." End quote. This was in the UK lockdown. In India, the Deputy Director of Childline announced that, quote, "India saw a 50% increase in the calls received on helpline for children since the lockdown began. This increase in rate is alarming and has made an increasing number of children victims in their own homes." End quote. Here in Australia, we see the same sort of thing. We see kids as well as adults reaching out to Lifeline and Kids Helpline at unprecedented levels. In fact, when the lockdown was announced on the 4th of August, 3,345 callers sought support from Lifeline Australia on that day. This was the highest volume of calls in the organization's 58-year history. Let me give you a direct quote from the director of Lifeline. He said, I quote, "To give you an idea of the scale of the number of calls we're getting, 2 years ago, we were getting 2,400 calls a day. Now we're getting an average of 3,300 calls a day." End quote. This is massive. We have so much evidence here, that from anecdotal evidence, but also logged evidence in terms of meta-analytical studies, in terms of accounts for call logs and people reaching out to crisis services, that the lockdown measures are really impacting those underneath the Victorian system of government at the moment and the lockdown measures that are being experienced. Let me continue on with the research. In September 2020, the European Psychiatry Journal, which is a peer-reviewed journal, published a paper called "Effects of Lockdown on the Mental Health of the General Population During the COVID-19 Pandemic in Italy." Now, this is an Italian study that measured their lockdown experiences, and what they found was that, quote, "Italy has been the first Western country heavily affected by the pandemic, and it has been the country with the highest number of infected and dead people for many weeks. On March 8, 2020, the Italian Prime Minister has placed 60 million people under lockdown." End quote. I want to really emphasize the next quote because this rattled me. This is a really deep one that was found given the relatively short in comparison to Australian Victorian lockdowns and the effects that these had. They said, and I quote, "Studies carried out during natural disasters, war, fires, and terrorist attacks found high levels of depressive, anxiety-related symptoms in the general population. But nevertheless, they were significantly lower compared to those we found in our study." End quote. I almost don't know what to say to this one. We have things like natural disasters, terrorist attacks, wars that induce a high level of anxiety, depression, trauma in the general population. But the lockdowns actually surpassed the anxiety and depression and trauma. The measures that were taken over there. This is what we see in the European Psychiatry Journal under their peer-reviewed data. This is mind-boggling. And if we're continuing to ignore the impacts of these lockdowns in comparison to other areas that have such significant impacts, we're covering something here. It's not okay. They went on to say, and I quote, "Good levels of perceived social support and of post-traumatic growth in the aftermath of the pandemic have been reported from the Italian general population participating in our survey. It may be that Italian social cultural context with strong family ties and social relationships may have positively impacted on the perception of mutual social support." End quote. Okay, this is important. So when these sorts of things ease, when lockdown restrictions ease and people go back to their families, they tend to recover quite well. But when we have no ability to spend time with our families, our friends, our loved ones, travel around, embrace, do all that sort of stuff, the things that kind of help us as humans, all the things that are restricted in terms of the current lockdown measures, this perpetuates the problem and makes it even more significant that people have started to say that these lockdown measures, the cure is worse than the disease. And I can kind of understand that because back in 2020, I put forward a LinkedIn article discussing the lockdown measures and how the only metric that was used at the time and still was used until it still is used right now was the daily case numbers. But what was missed was the negative mental health effects, the lost jobs, the suicidality, all that sort of stuff was not ever discussed. It was almost like it was ignored, which is quite disheartening because our government engaged in a mental health royal commission to investigate the mental health system and that sort of stuff. So to be ignoring mental health at this point in time is a big it's a blind spot of epic proportions that is going to reverberate into the next few generations. I don't want to be alarmist here, but what we know from a neurobiological point of view is that the effects of trauma and stress are hardwired into the human brain within the hypothalamic pituitary axis that high tunes and primes the brain's cortisol response in perception of stress, even to children and grandchildren alike. There's been a whole range of studies that investigated Holocaust survivors and their children and their grandchildren and their HPA axis, which is the other way of terming the hypothalamic pituitary axis, and how stress impacts these particular generations, as well as rats and mice that have been studied and have been stressed, and how they pass along their genetic sequencing in terms of stress and anxiety to their children up until, I think it's almost 8 generations. This is a massive deal, and we'll get to more of this soon. Moving on to another study published in the peer-reviewed journal called PeerJ. This was published in July 2021, and just a few months ago, actually. The study is called Change in Mental Health, Physical Health, and Social Relationships During Highly Restrictive Lockdown in the COVID-19 Pandemic. Evidence from Australia. So this particular study focused on Australian impacts, and it kind of looked at how social distancing and other types of restrictions affected people's sense of autonomy. Let me read for you what they say. Quote, mandated social distancing during a pandemic may detract from an individual's sense of autonomy, that is, sense of personal control and freedom, and relatedness, that is, sense of closeness to other people. The flow and negative impact on the economy may further exacerbate stress as people feel a threat to their competence, that is, sense of self-efficacy as jobs are threatened or lost. End quote. Now, you don't have to look far. You just travel to the city. If you're in that 5-kilometer radius at the moment, you would see so many shops closed for lease. It's almost like a ghost town. And a really tricky thing is that these are the real impacts to small business, and there've been considerable noise made by small businesses in terms of how these particular restrictions have been impacting them. Now, the current government starts to talk about different packages that will be given to these different businesses. But the question is, do these packages make up what is lost on a day-to-day operation of earning, that sort of stuff? I mean, it's really tricky because people are losing tens of thousands, if not hundreds of thousands, every single day when it comes to these lockdown measures. In this particular research study looking at Australia, they see that loneliness, restrictions, social distancing, the economic impact has been very significant as well. Quote, we found that during COVID-19 lockdown, 41% and 42% of participants were experiencing greater negative than positive emotional and physical well-being, respectively. End quote. Here's another quote. In our sample, 44% felt their mental health had deteriorated somehow, and 10% a lot. End quote. Now, what's really important is that this sample was of people in Western Australia, which experienced the least amount of lockdowns in Australia to date. And we have such significant outcomes when it comes to mandated social distancing and other restrictions that were placed on them. And the type of effects were very, very significant according to this particular research. I want to shoot back over to some anecdotal evidence as well, which again, this one comes from the Instagram pages where people have been reaching out. These stories, as I said, are really, really distressing. And so I'm going to read a few of them. Here we go. Quote, 3 teenagers in blank have passed through suicide this week. End quote. Take note of the next one. Quote, My friend is a funeral director in blank. She had to take 6 weeks off due to how hard it was seeing how many teenagers were taking their life. The real pandemic is the suicides. It's devastating, end quote. Why aren't we hearing about this? Why aren't we hearing about people who are within the system, within the mental health system, funeral directors, as in this case, where, according to this particular account, the real pandemic is the suicides? Here's another professional. Quote, I work in a busy emergency department in Victoria and have been devastated to see the amount of teenagers coming in for suicidal ideation and attempts. Worse enough, our state doesn't even have enough beds to facilitate their needs. End quote. Our state doesn't have enough beds to facilitate their needs. This is really, really difficult to understand because we've had over 19 months to try to find ways in improving the response within the medical system. We keep saying that we're going to get overwhelmed, we're going to get overrun, but in these cases, there haven't even been enough COVID cases to make it into hospital, and already the beds are being taken up. Where is the discussion around this? Who's taking up the beds? Is it mental health cases? Are there other types of cases? Are the beds being repurposed for other areas? I mean, we don't have this information. Here's another account. Quote, my wonderful friend took his own life 2 weeks ago. Lockdowns were terrible for his mental health. He was 17 and we are all destroyed. He was the most gentle and kind-hearted person, and his family are just the best people. It's not something you ever get through, especially for his mum. It's weird that the government needs us to stay home to save lives, yet doesn't address the mental health statistics. Lockdown is taking lives of young people and the stats are terrifying, end quote. This one took me as well. Quote, my brother lost 6 friends in this friendship group, all within 1 year, end quote. Now, this one came up a few times, so I'm not quite sure how to categorize it because 6 friends were mentioned, or 6 people within one school, one high school was mentioned a few times within the messages that were given. But we'll kind of come up with a tally based on these certain anecdotal references. But before we do that, I want to go back to the research and kind of interplay between the research and some of these responses. Let's go to the research again. Okay, this paper is a peer-reviewed journal article published by PLOS ONE, PLOSONE, and it's called A Mental Health Paradox. Mental health was both a motivation and barrier to physical activity during COVID-19 pandemic. This one was published in April 2021, so just a few months ago. They say, and I quote, our respondents were less physically active and more sedentary during the pandemic as compared to 6 months before. The pandemic also increased psychological stress, which was up by 22%, and brought on moderate symptoms of anxiety and depression, end quote. Let's talk about motivation. Quote, the majority of respondents were unmotivated to exercise because they were too anxious, which was up 8%, lacked social support, up 6%, or had limited access to equipment, up 23%, or space. This one was 41%, end quote. Now we know that in animal models, forced inactivity causes depressive symptoms, and experimentally controlled periods of exercise withdrawal in humans lead to increased symptoms of depression and anxiety. They say, and I quote, not surprisingly, government-mandated closure to gyms and other recreational training facilities made it more difficult for people to be physically active, end quote. Now, this isn't surprising. I mean, how many people get and draw mental health stability out of exercising? I mean, this is a major protective factor even to COVID-19 illness. And yet, closing gyms, even though there's been either very few or no transmissible cases within gyms, just makes absolutely no sense. It's a really difficult one because in here, we're taking away even more resources, just like the closure of playgrounds, even though there has been absolutely no evidence to talk about transmissibility. It was more done as a way of punishing the parents, according to recent press conferences in which the chief health officer had said that parents were too close together or taking off their masks when their kids were at the playgrounds. And yet the kids were the ones that were punished, and we see more and more and more effects of anxiety, depression, stress, trauma within the children, presenting even to hospitals, which is heartbreaking. Let's turn to some of the anecdotal evidence again. The following one is from a teacher. Quote, "I'm a teacher and we lost a young girl this year. There was a complete domino effect after that. I'm petrified to lose any more of them. The kids are struggling so much. I'd do anything to see them walk back in the school gates and hug their friends. I still can't fathom a 13-year-old would feel that was the only way out. And now I spend most days checking up on any student who is slightly off to me. I am okay. I just want all these kids to be okay." End quote. Next. Quote, "We live in a regional town out of Victoria. So many young people taking their lives in our community. I work at a school and a student took his life on campus. On campus. Totally devastating. We just cannot keep going like this. The burden on our kids is just too much." End quote. Next one. Quote, "I work with eating disorders and in general mental health, and the ages are getting younger and younger and they are getting sicker and sicker. There are not enough therapists and dietitians to see them all. And we are all so burnt out and distressed. But who will help if we take time out? It is a tragedy." End quote. Now, the eating disorders one is a really difficult one because so many people are saying that more and more girls are developing eating disorders that get in the way of them valuing themselves, high levels of depression and anxiety and comparing behaviors. And this is really, really tough. Let's look at an ED nurse, emergency department nurse. Quote, "At work right now in a Melbourne ED, and we have 2 teenagers in here right now that have tried to end their lives." End quote. Next one. Quote, "2 beautiful souls took their own lives at my son's high school. We cannot continue living this way. They were both only bloody 17. End quote. What about the next one? Quote, "My cousin is a psych nurse at Alfred. She said they've been turning kids away since lockdown 2. Meanwhile, there's other floors in the hospital completely empty, and they won't allocate more space or beds for the psych patients. Disgusting. Honest to God, she said in lockdown 2, when the news was reporting the hospitals being inundated, that Alfred was literally dead, sending nurses home after working minimum shift hours." End quote. I don't know what to make of that one, because here we have a statement that some of these statements conflict with each other based on their personal opinions. The other statements we have the hospitals being full but not with COVID patients. Other times we have mental health patients being sent away and waiting 3 to 6 months or more for any type of support, even though there are beds literally empty. There's so much that hasn't been asked, and these questions need to be asked. These mental health professionals need to stick up and talk about this sort of stuff. I don't want to spend too much time dwelling on that part, but let's move into the research again. Now, this study was published in the peer-reviewed journal called Progress in Neurology and Psychiatry, and basically what they found was, quote, "According to a recent WHO, so World Health Organization, survey, the COVID-19 pandemic has disrupted or halted critical mental health services in 93% of countries worldwide, while the demand for mental health is increasing. The annual 2020 NHS staff survey from September to December 2020, which was 595,270 responses, reported 44% of all staff, that's 40% of doctors, being ill from work-related stress, a significant increase from 40% in 2019 and 37% in 2016, end quote. Now, this one's huge. All right, so we have 93% of countries, according to the World Health Organization, that are experiencing a massive delay in terms of mental health provision. And then we've got the waiting times being significant. I mean, from From my own anecdotal experiences, speaking with other clinicians in the field, after every single lockdown, teens kind of flock to these mental health services where they're being inundated with different referrals. And teens are experiencing a lot, as was already seen with the accounts that I've been reading out from social media. This is what's happening, and then yet they're waiting so long to have any type of support here. According to the research, this is borne out with the research, and from 2019 there's a 40% increase. 2016 there's almost a 40% increase, according to the Progress in Neurology and Psychiatry article. What about the University of Melbourne? Well, in 2020 they put together a report, and they said, I quote, "Children who experienced a second lockdown in Victoria were 2 to 5 times more likely to show emotional and behavioural difficulties than children in the other states," end quote. We are now on lockdown number 6. Kids have been more at home than they have been at school. They've been restricted from doing fundamental activities that kids are supposed to be doing when it comes to playing around, meeting with their friends, developing social awareness, being able to connect with other kids from a social point of view, and regulating with friends and family members. This is all stolen from them based on these lockdown restrictions. So how do we continue with this? I'm gonna cite another article here from the Italian Journal of Pediatrics. It's a peer-reviewed journal article published in 2021, and we're talking about smartphones. The article is called "Smartphone Use and Addiction During the Coronavirus Disease 2019 COVID-19 Pandemic Cohort Study on 184 Italian Children and Adolescents." They say, and I quote, "Our study showed more frequent smartphone use among Italian children and adolescents during the COVID-19 pandemic compared to the pre-epidemic period," end quote. Okay, this is a no-brainer. I mean, most kids who are doing work from home, so school work from home, are having higher rates of addiction to their devices. This facilitates a lot of anger when they're parted with their devices, and parents who are trying to work, they're almost helpless to try to mitigate this, because they're trying to manage a whole range of different things for their work, and yet it comes down to the kids going on technology for a significant period of time. I mean, the medical advice is often 1 hour a day to be on technology, and yet we're averaging rates when it comes to addiction forming, which is really, really tough. Let me continue to read. Quote, "This led to many clinical, which is sleep, ocular, and musculoskeletal disorders, psychological, distraction, mood modification, loss of interest, and social, superficial approach to learning, isolation, unfavorable outcomes," end quote. Well, it doesn't surprise me that more and more kids will have trouble with their sleep, will have trouble with their focusing in terms of their eyes. So things like developing short-sightedness, and also things like musculoskeletal disorder, so bending forward, and spinal issues, and constantly sitting down and not being able to get much movement, psychological, getting more distracted, mood issues, loss of interest in whatever it is that they're doing outside of life, at school, and then superficial approach to learning and isolation. I mean, how many who are listening today have had children who are just trying to rush through their work? This is happening so often, and is borne by the peer-reviewed research as well. What about the most vulnerable of our kids and the effects that they're experiencing with these particular restrictions? Well, in 2020, the peer-reviewed journal Early Childhood Education Journal published an article called "Impact of the COVID-19 Pandemic on Early Childhood Care and Education." They said, and I quote, "Particularly for children who are living in poverty, chronically ill, have disabilities, experience housing and food insecurity, reside in remote areas, and marginalized by mainstream society, or are suffering from neglect or abuse, problems are exacerbated by these pandemics." Now, one can argue that that was referring to these pandemic situations rather than pandemic responses. But what I've seen as well is that it's the people who are the most vulnerable that are disproportionately affected by these particular restrictions. Now, what do I mean by that? People who have addiction, people who have significant mental health problems, further isolate them, you start to experience significant amounts of exacerbation in mental health concerns, and their children as well. I mean, living with a family, with a parent who's experiencing a significant amount of mental health distress, you begin to see this sort of stuff perpetuate and start to carry on in the kids. Modeling behavior, all this sort of stuff is really devastating when we look at those who are under significant duress. Another journal that's peer-reviewed again is called the Journal of Psychiatric Research, which published an article in August 2021 investigating mental health and substance abuse in terms of COVID-19 lockdowns. They said, and I quote, "Investigation of mental health in a region with one of the longest lockdowns and lowest COVID-19 prevalence globally, Victoria, Australia, allowed for evaluation of mental health in the absence of substantial direct pandemic mental health consequences. In September 2020, among 1,157 Victorians, 1,157 Victorians, 1/3 reported anxiety or depressive disorder symptoms. 1/5 reported suicidal ideation, and 1/10 reported having seriously considered suicide in the prior 30 days. 1/10 reported having seriously considered suicide in the prior 30 days. That's 10%. I'll continue. Young adults, unpaid caregivers, people with disabilities, and people with diagnosed psychiatric or sleep conditions showed increased prevalence of adverse mental health symptoms. Prevalence estimates of symptoms of burnout, anxiety, and depressive disorder were unchanged between April 2020 and September 2020, end quote. So things aren't getting better. And in fact, I would argue that in terms of the mental health duress in 2021, a year later, September, a year later after this was published, after the period of the investigation period where this particular report was published, we're in lockdown 6 again. I mean, to emphasize the point, we are continuing to experience these negative impacts, and the mental health of our children, of our adults, of those most unfortunate are taken without consideration. It's really, really difficult. And if there is consideration, it's not being communicated to the public, nor even mental health practitioners. And I stress, this isn't being discussed within the mental health field, nowhere near as it needs to be. In fact, in my own personal conversations with with people who are within the mental health field, I start to see that people are either too afraid to discuss this because of various regulatory bodies that are either silencing their expressions of these particular lockdown considerations, or they're just either not aware, or I think one of the main things is the fear that is being propagated. How about we look at the substance use and the impacts of substance use? This is taken by a particular report in the Australian government report that looked at alcohol and drug use, and they polled 1,045 Australians between 18 years and over between 3 and 5 April 2020. Now consider that was over a year ago now. This is the data that we've got. 70% reported they were drinking more alcohol than usual. 34% were now drinking alcohol daily. 28% reported they were drinking alcohol to cope with anxiety and stress. 32% were concerned with the amount of alcohol either they or someone else in their household was drinking. This shouldn't come as a surprise that when people who are faced with significant amounts of stress, if their go-to regulatory strategy is to drink alcohol or use drugs, they're going to do that. They're going to continue it. And since bottle shops and and shops that sell alcohol aren't being closed down, they consider they're going to purchase these at increased levels. And from a therapeutic point of view, it is difficult, because if all other types of protective factors are taken away, you're not allowed to visit friends, you're not allowed to do hobbies, you're not allowed to engage in sport, you're not allowed to go to the gym, you're not allowed to spend time outside, you're feeling demotivated, feeling more stress, you're being told how to live your life, you have all these constraints put on you, you have all this control taken away from you, you have less of an ability to make decisions as a person, you have less confidence in your ability to move forward, and there's all this moving goalposts around when anything's going to change. I mean, this is a lot to take in, and often people turn to substances, as we've seen here, a significant increase in substance use, especially in terms of alcohol use within these periods. The final study I'm going to refer to is a study published in medRxiv. It's a health sciences journal which looks at preliminary research that often disseminates, since 2019, has been disseminating COVID-19 research, since COVID-19 has become more of a predominant research interest. And the article is called Impact of the COVID-19 Pandemic on Early Child Cognitive Development, Initial Findings in a Longitudinal Observational Study of Child Health. This was published in August 21, last month. Okay, really tricky one, because it shows the people who undertook this study, they found, and I quote, this is what they say: "We find that children born during the pandemic have significantly reduced verbal, motor, and overall cognitive performance compared to children born pre-pandemic. Moreover, we find that males and children in lower socioeconomic families have been most affected." End quote. Okay, we've already covered this, that the people who are most disadvantaged are the people who suffer the most. Let's continue. Quote, "From the beginning of the pandemic, there has been concern that these public health policies would adversely impact infant and early childhood development and mental health. In the absence of direct SARS-CoV-2 infection, environmental exposures associated with COVID-19 pandemic can affect the developing infant and child through multiple pathways. The human brain is unique in its prolonged developmental timeline. Infants are born with relatively immature brains that, like them, are simultaneously competent and vulnerable. Infants are inherently competent in their ability to initiate relationships, explore, seek meaning, and learn, but are vulnerable and depend entirely on caregivers for their survival, emotional security, modeling of behaviors, and the nature and rules of the physical and socio-cultural world they inhabit. The infant brain is likewise born with immense capacity to learn, remodel, and adapt, but is sensitive and vulnerable to neglect and environmental exposures that begin even before birth. Optimal brain development depends on secure and trusting relationships with knowledgeable caregivers who are responsive to the infant's needs and interests. Neurodevelopmental processes like myelination and synaptogenesis, for example, are stimulated by external cues, and experiences like maternal interaction and physical skin-to-skin kangaroo care, touch, and warmth. The brain's adaptive plasticity, however, is a double-edged sword. While positive and enriching environments can promote healthy brain development, neglect, insecurity, stress, and lack of stimulation, and this is really important, lack of stimulation can impair maturing brain systems and disrupt cognitive and behavioral outcomes. Maternal stress, anxiety, and depression in pregnancy can impact the developing fetal and infant brain structure and connectivity, leading to potential delays in motor, cognitive, and behavioral development. Overall, we find that measured verbal, nonverbal, and overall cognitive scores are significantly lower since the beginning of the pandemic. Looking further, we find that children born before the pandemic and followed through the initial stages do not show a reduction in skills or performance, but rather that young infants born since the beginning of the pandemic show significantly lower performance than infants born before January 2019, end quote. That was a significantly long quote, but I think it gets to the heart of the program. Kids and unborn children, or who are born through the context of this pandemic, have been suffering the most. That's the final peer-reviewed study that I want to bring to terms right now. But at the same time, I really want to consider and close this off by reading and giving ear to those who are suffering the most. So I'm going to continue to read some further accounts. Again, these come from Instagram. I've quoted who they come from. And again, I cannot verify these. I did not receive these personally. What I can say is that these are the experiences of the people who are sending them through. Let's go. Quote, "It's an absolute crisis. We have been told to wait 3.5 months for our 17-year-old son to see a psychiatrist. What happens in the meantime? And we know of a 17-year-old girl who suicided a month ago, and another boy and girl who have both tried to commit suicide in the past 4 weeks. The kids are broken," end quote. This next one is from a pharmacist. Quote, "I've seen people come into the pharmacy with black eyes, or running away in the middle of the night with no toiletries or anything on them and running in to buy some. Also had patients on the pharmacy beg me to keep their medicines and only give them a couple of days supply at a time, since they don't trust themselves to have it at home and think they'll overdose if they have access to their meds. A mother told me last week her daughter was suicidal when she can't get into a psychologist for 6 months. Oh, and by the way, health professionals have a gag order on them with the threat of being reprimanded by AHPRA should we wish to post any of our views on the social media," end quote. I think that's really scary, that regulatory bodies, as we've mentioned before, are silencing people. Next one. "A dietitian I know who specializes in adolescent eating disorders has been completely overwhelmed, going from 4 new referrals a week to literally hundreds. It's alarming," end quote. All right, here's the next one. Quote, "I know a primary school teacher whose son unfortunately took his own life last week. I cannot imagine how it would feel to be stretching yourself as a parent from teaching to schooling to parenting. It's just all so devastated. He was 13 and the 5th boy to commit suicide in this year at school," end quote. Now, this again is another example of 6 children who had committed suicide, and I'm not quite sure how to verify whether they were referring to the same thing, but that's just another story. Next one, quote, "My husband has a mental health practice in WA. It's new, so there is minimal wait time for appointments. Psychologists, psychiatrists, social workers and counsellors, although at WA, they offer telehealth appointments if that's helpful," end quote. And this is important because some people are trying to reach out to help and other people are either trying to bury this and not quite sure how to help. Here's the next one. Quote, "My daughter's school sent out an email on Friday to say a year 9 boy from a neighbouring school committed suicide that morning. That's a 14 or 15-year-old child. Who are we protecting? This has to stop now. Our kids are not okay," end quote. Next one, this is an experience from a nurse. Quote, "I'm a nurse doing further study. I recently did placement on a mental health ward at a major public hospital. If only the politicians could walk through and see what they are doing to these poor people. Parents not coping, struggling with homeschooling, domestic violence, financial impacts, so they attempt to take their own lives. Young people who should be in the prime of their lives. Not to mention the increase in drug and alcohol use," end quote. So here we go. That's another common story where nurses are reaching out and saying this is not okay. Next one's from a police officer. Quote, "I'm a cop. so have had to remain impartial on everything COVID-19. The amount of mental health sections we go to, as well as domestic violence, has gone up severely. And on top of that, we're having to police it all. To say we're burnt out and over it is an understatement. It's so sad that we're taking the same patients to the hospitals every shift, a lot of extremely young kids, and dealing with the same families who are really struggling, resulting in family violence. Having a little one myself just makes me feel for all of the parents who have to see their beautiful kids struggling and wanting to take their own life. I feel for every single frontline worker who is there to pick up the pieces. The system fails people. Thanks for being a voice, and they're thanking, end quote, they're thanking the person who's running this page. The next one is from a paramedic. Quote, I'm a paramedic working tonight, and the only jobs we are doing are mental health. It is 100% our biggest issue right now, end quote. Next, quote, 2 weeks ago, a 17-year-old boy committed suicide in our community. He couldn't cope anymore. He just wanted to live his life like a normal 17-year-old kid. This is the real pandemic and is effing terrifying, end quote. Next one's again from a nurse. I work as a nurse in an acute psych ward, and it's absolutely devastating to see such an increase in the number of children and young people admitted for crisis admissions, for self-harm, suicide attempts, and family violence. It's so disheartening to see such young people experience such awful pain and suffering. They really need to address the loss of lives in the press conferences and implement more strategies to help prevent those tragedies. They should focus more on saving lives from suicide, not from COVID during this lockdown. Absolutely tragic. Now, I'm just reading these particular stories. It's important to know that these experiences, they relate to the people who are going through them and who have sent these through, and don't necessarily reflect what it is that I believe myself, although there may be parallels. The next one is, and I quote, my friend's 14-year-old daughter talked of killing herself earlier this year. Her parents tried every avenue to get her daughter help, but every psych, public or private, said they weren't taking new patients. Lucky the mum didn't take no for an answer and managed to contact an agency who could send out some techniques to help her. But for some reason they couldn't see her physically. Kids not only need school, they need sport, dancing, drama, music, whatever their thing is, they need to feel normality. End quote. Now, I think that one's really important, that when it comes to overall mental health, we need a whole range of different things that are going to help. Not just being saved from a particular virulent disease, but being able to engage in life. I mean, where is quality of life factored into all this? Next one's here. Quote, my friend is a social worker and had to leave her job last year. She couldn't take it. Teenagers were committing suicide, all between 14 to 16. There were about 6 of them within the period of a few weeks, and we didn't hear anything about it on the media, of course. They never show that, end quote. Next one again is from a social worker. She says, I'm a social worker and work for a family violence and family support service. We have an extensive wait list for families to receive any type of family violence case management and practical supports for families. We are inundated with calls about children's mental health, suicide ideation, eating disorders, anxiety, depression on the daily. I have never fielded so many of these calls, and these calls are coming from every parent, the most vulnerable, to the families who don't have other adverse circumstances. Parent stress is increasing, particularly ones with children with high or special needs and disabilities, or families with multiple children and or significant trauma-related issues. These lockdowns are breaking our children. Parents are merely holding on. Family violence is escalating, which children can never escape from. Schools are generally a child's safe place, and this is no longer an option, end quote. The next one is from a psych nurse. Quote, I'm a psych nurse, and at the moment it can take anywhere from 3 to 12 months to organize an initial appointment with a psychiatrist in the private system. End quote. Now, what does this say? If you're waiting between 3 to 12 months to organize an appointment in the private system, this is not okay. I don't even know how to respond to this one, because if a person is in significant distress, they need to be seen then. I mean, and they're being turned away at hospitals according to these accounts. The hospitals are becoming inundated with these particular requests, and yet there's so many. I mean, I've got so many more to read, but I don't have time to go through every single one. If you are interested, I would highly recommend you visit Instagram, Rosalia_Russian and Shadow Pandemic Vic. Now, these are the two sources that I'm building from. Now, there's been some flack back on these particular users, and I'm just reporting what they are experiencing here. And to me, as I read these particular stories, I will take them as they are. I will assume truthfulness until I am proved otherwise, and I will see how they relate to buffered against the peer-reviewed research that I've identified so far. Now, I'm going to read just a couple more. Quote, I'm a pediatric nurse who recently resigned from the specialty because I was so burnt out with all of the adolescent mental health issues, overdoses, eating disorders mainly. I'm so sad because pediatrics was my passion and I just couldn't see it anymore. It was too heavy. End quote. Now, next one is from a maternal child health nurse, and she says, quote, as a rural maternal child health nurse, I potentially have a different insight to the younger generation we are seeing. The children born at the start of lockdowns are now coming up 18 months old, and we are seeing a complete difference in kids this age than we normally would. They are extremely clingy to their parents and are very hard to engage with during our assessments. These kids have had minimal socialization through the normal ways of playgroup, new parent groups, and I have concerns. What is going to happen to these kids get older? I feel we are creating a whole generation of mental health in kids from 0 to 18. Even kids at kinder are struggling. Thank you for sharing a light on something so important, end quote. Now, if you compare this to the final study that I presented, you have these parallels. So these particular experiences are coming from multiple different sources, and that's what you want. You want independent verification of these particular issues, as we would see in any type of scientific review. Let's go to the next one. Quote, my 7-year-old spoke of taking his life last year. He's the funniest, happiest, most caring boy. It was devastating for his dad and I. It took us totally by shock to the point that we had no idea how to respond. I just held him in my arms and we all cried. We had stayed pretty upbeat at home, doing lots of activities, but it clearly wasn't enough. He kept saying to me, I miss our old life, Mum. I miss my friends and family. We spoke about what he thinks killing himself is. I asked him how he would do it. He didn't know, thank God. We explained to him he would never come back, and we're all here together. That's what matters. Now I have to make sure he sees people every day and he attends school twice a week because it got so bad. I feel ashamed as a mum, like I failed him. I failed at life, seeing him so sad. End quote. Here's another one. Quote, I'm a nurse at a major Melbourne hospital and the presentations for self-harm and suicidal ideation are so overwhelming. Also, people are so anxious being in a hospital environment and are presenting later than they should due to being frightened of catching COVID. But it's important for people to know hospitals are a safe environment to receive any medical care they need. End quote. Now, the next one is around other medical professionals. Quote, my husband is an anaesthetist. And when he was working out at Kilmore during the second lockdown last year, nurses from the Austin and the Northern were working with him. They said that their ICU departments were full, not full of COVID patients, but full of patients attempting suicide. Mainstream media would never tell you that. Dan has blood on his hands and he is so out of touch with the mental health struggles of Victorians. It's utterly heartbreaking. and we just need to shut up and deal with it. God have mercy on us, end quote. All right, this is a tricky one because it goes down to the Premier of Victoria and the accusations that are made here that this person has blood on his hands. There are, as I said, there are many others that I could draw from, but like I said, let's keep moving along, and I want to draw from a couple more. The next one is a police officer's one. Quote, "I have been screaming this from the rooftops for the last 12 months. As a police officer, this is the real pandemic. When we go to the hospitals, they're lined with mental health jobs also. People don't want to believe it. Last night was a 9-year-old girl." End quote. I'm going to stop there because I can't just keep reading these accounts over and over and over again. We've hit over an hour, and I thank you so much for continuing on with this. But rest assured, what we can do is we can spread this awareness as a beginning. If you're a mental health professional, discuss these effects, discuss these stories, discuss these peer-reviewed journal articles that I've put to light. Discuss what's actually going on, what's happening here. Don't be afraid of talking amongst yourself. The more and more people become aware of this sort of this shadow pandemic, as it's been called, the more awareness we'll have and the more change we can facilitate. Now, on the flip side, what do we do about it? Well, first things first, we've got to check in with the people we love the most. And in the end, everyone does something that they need to do based on their own decisions. If you need to do something that you think will help somebody else, this is up to you. And I think it's really important to know what it is within your window of tolerance to go out and provide support and do that sort of stuff. But in the end, it's a matter of knowing what it is that you can provide, what's your level of support that you can give, hearing somebody else out, and just being able to be there with them is a really important one. If you've got kids, routine is one of the most important things. Establishing routines and making sure they get enough sun, making sure they get enough love, making sure they're heard when you talk about this sort of stuff with them. And all things that you may already know. But I'd love to hear from you. If you've got any stories, if you've got anything that you want to share with me, I would love to take it on board and start to understand where you're coming from. You can email me, or you can reach out directly to me on Instagram. My Instagram tag is the Emil Barna, so TheEmilBarna, or you can email me at emiliobarna@gmail.com. That's spelled EMILIOBARNA@gmail.com. And if you really want to help me out to spread this message as far as I can, subscribe to me on YouTube, my channel, where I share a whole range of mental health related considerations and research and what helps from a practical point of view. And that is youtube.com/Emilio Barna, EMILIOBARNA. Don't forget to subscribe and share this sort of content around. I'll leave it there. I've got some other interviews coming up where I'm going to be chatting a little bit around the COVID-19 lockdowns from a neuroscientific point of view, so stay tuned with that, and we'll take it in stride.